Later in the program, I'll show you the latest in construction toys, ones that use robot technology. And our hyperlink will connect flying frozen chickens with a Russian flying saucer. But first, Dr. Edward Grieve on the procedures that are helping save some of our youngest patients. We would like to advise, however, that some viewers may find some images of the surgical procedures a little disturbing.
Even in its infancy, the fragile miracle of life has an ally. Modern medicine and surgery can now keep alive babies born up to 4 months premature. But the surgeons pushing back the boundaries of surgery realized that sometimes it still wasn't soon enough.
We were frustrated because we would see problems at birth that were already life-threatening, or most of the kids died. It seemed so obvious to me that once we perfected techniques to fix problems in younger and younger children, and then in babies, and then in newborn babies, that some of them would just have to be fixed before birth.
Don't give you the finger.
Michael Harrison is the paediatric surgeon considered the pioneer of fetal surgery, having performed the first ever procedure in 1981. Since then, he and his team at the Fetal Treatment Center at the University of California, San Francisco, have been perfecting procedures that save life before life in this world has even begun. In surgery, the barrier of birth has been breached. Fetal surgery is a rare medical marvel. With the life of the mother potentially at risk as well as the child's, just 1 in 10 people assessed go through with it.
You've got a child, you want to celebrate the birth, and yet there's anxiety, there's stress, and there's a lot of fear associated with it.
You said it.
Maybe we want to call Grandma and Grandpa and tell them about the day? That'll be cool.
When Carol Huber was just 16 weeks pregnant with son Ben, tests revealed a problem. As a fetus, Ben had a diaphragmatic hernia, a large hole in the muscle separating the abdomen from the chest cavity. The Hubers were told Ben would not survive this condition.
When the organs shift up into the chest, during the period when the fetus is developing, it prevents lung growth because there's no room in the chest cavity for the lungs to develop. So it is a very, very serious congenital birth defect.
Just 10 weeks after diagnosis, Dr. Harrison and his team operated on Carol and her 26-week-old fetus. The procedure involves making a large incision in the mother's abdomen and then a further small incision under the arm of the fetus. In a delicate and complex procedure, the child's organs protruding into the chest cavity are pulled back down into the abdomen and held in place with a special pouch. This created room in Ben's chest for his lungs to develop. Ben's a pioneer in his own way because not only did he receive major surgery before birth, he was also one of the first in the world to receive a radio transmitter, which was inserted just here under his arm before he was placed back in the womb. The trauma of major surgery can bring on premature labour, something that can be prevented if it's caught early enough. But monitoring a fetus becomes difficult once it's placed back inside the womb.
You wouldn't take a newborn baby and do open heart surgery or the equivalent and stick him in a corner and cover him with a blanket and, come back in 2 days, see how he did. I mean, you've got to keep track of him minute to minute, second to second to respond to changes in his vital signs. You've got to keep track of him.
Main engine start, 3 engines up and burning. Liftoff of Space Shuttle Discovery.
The answer to the problem came not from medical, but space research.
Roll program, Houston. Roger, roll, Discovery.
The difficulties in monitoring a fetus in the womb of a mom are very similar to the difficulties of monitoring an astronaut on board a space shuttle.
Discovery Houston, we see you on internal power for the EMUs. You have a go for EVA.
The analogy was striking, right? A little fetus on his little umbilical cord, his lifeline floating around in there, and an astronaut floating around in space. And in both cases, you need to monitor the signs.
So the Fetal Treatment Centre enlisted the help of NASA's Ames Research Centre. And Ben was the first to be implanted with a prototype of this smaller NASA capsule. Powered by 2 standard watch batteries, the pill consists of transponders which monitor vital signs such as fetal heart rate and temperature, as well as pressure changes within the womb that can indicate premature labour.
Our pill can monitor the frequency of contractions, the intensity of contractions, and all this data can be used by the doctor to predict preterm labor early enough to prevent it.
Stop, John!
And as with Ben, the longer a fetus can stay in the womb, the better the chance of recovery and survival.
This helped them monitor more closely and more accurately the contractions that I was having immediately after the surgery.
Yeah!
And thanks to the groundbreaking fetal surgery and some space-age technology, Ben is a normal, healthy and happy little boy.
I feel very strongly that without the fetal surgery, Benjamin would not be here.